As the World Health Organization prepares for a crucial vote on the pandemic treaty and changes to the international health regulations, concerns about global governance and national sovereignty are reaching a fever pitch. The assembly will take place in Geneva from May 27th to June 1st. If approved, these changes would transition the WHO from an advisory body to an authoritative entity capable of enforcing its directives globally, effectively establishing a world government run by unelected bureaucrats. Tedros Adhanom Ghebreyesus, the first WHO Director General without a medical degree, has previously served on the board of GAVI, a Bill Gates organization. Given that Bill Gates organizations are the second largest funders of the WHO, Gates has significant influence over global health policies, a fact underscored during the COVID-19 pandemic. Despite his lack of medical credentials, Gates advocated for widespread vaccination, asserting that life couldn't return to normal until nearly all 7.5 billion people received the COVID-19 vaccine. Gates has since acknowledged that these vaccines do not prevent infection and has remained silent on their safety concerns, despite widespread assurances of their safety and efficacy. Dr. Meryl Nass, founder of Door to Freedom, will provide live coverage of the WHO meeting starting May 27th at 2 p.m. EST. According to the site, 24 U.S. governors and 22 state attorneys general have signed letters opposing the WHO treaties. Dr. Nass also highlights that 11 countries, including Belarus, Cuba, North Korea, and others, have informed the UN General Assembly of their refusal to support the WHO's pandemic preparedness initiatives. In Europe, the Netherlands' lower house of parliament has instructed its government to delay or vote against the WHO proposals. Slovakia has declared it will not sign the current drafts of either document, and Croatia's new majority party is against the WHO's pandemic preparedness plan. Italy's Senator Borghi has stated that Italy will vote no on the treaty, and there are 10 more months to reject the IHR amendments. The world is closely watching as delegates gather for the 77th World Health Assembly in Geneva to discuss global health governance. However, there is significant opposition from various countries, including Japan, Germany, Slovakia, and the United States. Meryl Nass and James Corbett, co-hosts of Good Morning CHD, will return to CHD TV to present a final warning about the implications of the May 2024 meeting. They will discuss the critical points related to the WHO's proposals and their potential impact on global governance and individual freedoms. Dr. Nass explains that on May 10th, Slovakian Prime Minister Robert Fico publicly opposed the WHO pandemic treaty. Just 10 days later, Tedros visited Slovakia, urging Fico not to break the consensus. 5 days after that visit, Fico was shot in the abdomen and is now in critical condition, marking the first assassination attempt on a European leader in 2 decades. The new government, led by populist Robert Fico, won a mandatory confidence vote amid this turmoil. Similarly, the president and foreign minister of Iran, a country that opposed the WHO pandemic treaty, died in a helicopter crash on May 20th. Iranians believe the deaths were orchestrated. Additionally, Tanzanian President John Magufuli, who exposed fraudulent PCR tests, died of a heart attack at age 61. Reuters previously addressed claims that 5 leaders who died in office were killed for opposing COVID-19 vaccines. The unfounded assertion includes the deaths of Jovenel Moise of Haiti, John Magufuli of Tanzania, Hamid Bakayoko of Ivory Coast, Ambrose Dlamini of Eswatini, and Pierre Nkurunziza of Burundi. Despite widespread speculation, there is no evidence linking their deaths to their stance on COVID-19 policies. The upcoming vote on the WHO's pandemic treaty and IHR changes raises critical questions about transparency, global health governance, and the preservation of national sovereignty. The involvement of influential figures like Bill Gates and organizations like the CIA and Global Health Initiatives underscores the need for accountability and clear boundaries. The WHO's shift from advisory to authoritative status could have profound implications, making it imperative for specialized, transparent, and accountable entities to manage public health.